Education is not the learning of facts, but the training of mind to think. Welcome back to our channel. Please subscribe to us right now if you've not yet done, and if you don't want to miss any lectures, please put on the notification bell. On viewers' choice, we are uploading this very important lecture, the highly demanded local anesthetics. So we would be studying this local anesthetics chapter in 3 parts, 1, 2 and 3. In part 1, we will be studying the introduction to local anesthetics, the classification of local anesthetics, the chemistry of local anesthetics, then the difference between general and local anesthetics, and the difference between the amide and ester group of local anesthetics. In part 2, you will be studying the mechanism of action, local actions, systemic actions, pharmacokinetics, adverse effects and precautions to be taken while using the local anesthetics. In part 3, we will be studying the individual compounds which are used as local anesthetics, the uses and the techniques used in local anesthesia, and the most important topic for dental students, that is the local anesthetics in dentistry. So let's start the local anesthetics part 1 lecture without wasting any time. So the introduction, the local anesthetics are defined as the drugs which upon topical application or local injection cause reversible, note here, reversible loss of sensory perception, mostly pain, in a restricted area of the body. So there is a reversible loss of sensory perception or pain in a restricted area of the body. Now, how does this local anesthetics work? The local anesthetics, they block the generation and conduction of nerve impulses at any part of the neuron which they come in contact. So these are the local anesthetic agents, and when they come in contact with the neurons, they block the generation and conduction of nerve impulses through these neurons. So this is the simplified mechanism of action of local anesthetics, that is blockage of the generation and conduction of nerve impulses through the neuron in which they come in contact. So local anesthetics are employed routinely in dentistry, and currently the dental practice is inconceivable without local anesthetics. Now, the classification of local anesthetics, there are two modes of classification. One is the route of drug administration, and second is the chemical structure of the anesthetic drug. So, depending upon the route of drug administration, there are two types: injectable local anesthetics and the surface acting local anesthetics. The injectable local anesthetics, depending upon their potency and duration of action, are divided into low potency, intermediate potency and high potency local anesthetics, while the surface acting local anesthetics are divided into soluble and the insoluble anesthetics. Now, the injectable local anesthetics with low potency include procaine, chloroprocaine and articaine. So, the low potency injectable local anesthetics include cap, chloroprocaine, articaine and the procaine. Then the intermediate potency include lidocaine or the lignocaine and the prilocaine. So these two, prilocaine and the lignocaine, are the intermediate potency ones, and the high potency includes bupivacaine, ropivacaine, dibucaine and tetracaine. So these four are the high potency injectable local anesthetics. Now the surface acting local anesthetics are of two types, the soluble and the insoluble. The soluble include cocaine, lidocaine or the lignocaine, tetracaine and proparacaine. And the insoluble include benzocaine, butylaminobenzoate and oxetazine. Now, depending upon the chemical structure, The local anesthetics are of two types, the ester-linked compounds and the amide-linked compounds. So the ester-linked compounds include cocaine, procaine, chloroprocaine, tetracaine, benzocaine and proparacaine. While the amide-linked group include the lignocaine, bupivacaine, ropivacaine, dibucaine and the prelocaine. So you should remember these two modes of classification of local anesthetics because they are asked routinely in exams. Now, let us study the comparative features between a general and a local anesthetic. Now, for general anesthesia, the site of action is the CNS, while in local anesthesia, the site of action is the peripheral nerves. In general anesthesia, the whole body is anesthetized, while in local anesthesia, a restricted area is anesthetized. There is loss of consciousness with the use of general anesthetics, while with the use of local anesthetics, the consciousness is unaltered. The care of the vital functions is necessary when using general anesthesia and it is not needed when using a local anesthesia. Physiological trespass is high in general anesthesia while it is low in local anesthesia. Poor health patient is at higher risk using general anesthesia while local anesthesia is safer in such patients. Use in non-cooperative patient is possible in general anesthesia while local anesthesia use is not possible in non-cooperative patients. For major surgery, general anesthesia is preferred upon local anesthesia, while in minor surgery, local anesthesia is preferred upon general anesthesia. So these are the point of differentiation which are asked in exams. So get thorough with this chart. The next is the comparison between the amide group local anesthetics and the ester group local anesthetics. Now, the amide group local anesthetics, that is the lignocaine, bupivacaine, ropivacaine, dibucaine and the prelocaine. They produce more intense and longer lasting anesthesia than the ester group. They bind to the alpha-1 acid glycoprotein in the plasma. They are not hydrolyzed by plasma esterase and they rarely cause hypersensitivity reactions. And there is no cross sensitivity with ester allele. So the amide group have more acceptable features than the ester groups. So remember these 4 points why the amide groups are preferred than the ester groups. The next lecture will be on the part 2 of local anesthetics. Hope you like this lecture. If yes, put on the thumb icon. That's all for now. Happy studying.